Hello. Thank you all for participating in today's walkthrough of the Innovations Waiver Waitlist Dashboard, otherwise known as the Inclusion Connects dashboard. Today, we will be covering the entire dashboard and how you can navigate your way through in order to find the information that you need. We're first starting off with the Demographics tab, where we have both demographic and diagnosis information. On the left of this tab, you have our demographic information, where we have waitlist count, a breakdown of genders that were listed on the waitlist, as well as race distribution, age, and where individuals are by county. To the right, you have diagnosis information, where it has an entire list of diagnoses and their counts, and you can scroll through and figure out which ones you're most interested in. The important part of today's walkthrough is showing you how you can change visuals based on the information that you want to see. So to start off at the top, we have a reporting period filter where you can change the filter or the dates that you're interested in, and they are quarterly. So you'll see March, December, and September. You can just click on one and it will change according to the date range provided. You can also filter by tailored plan or LME MCO. So here, if I was interested in Alliance, I would be able to click Alliance and all of the visuals on the screen would change according to that. And if I was interested in getting it back to its base, then I would just uncheck that box. You can also do the same directly from the visuals themselves. So say if I was interested in the Asian or Pacific Islander population on the wait list, I would click the bar that reflects that, and then all of the visuals would change accordingly. If I want to reset, I would simply click the same bar. You can do the same for all of the visuals, including the map. Similarly, you can do the same with diagnosis information. Please keep in mind that the light blue indicates that a diagnosis is a qualifying IDD diagnosis, and dark blue represents the opposite. So it is not qualifying diagnosis. But let's say I was interested in Down syndrome. I would click that, and then the bars and the visuals would change accordingly. Lastly, at the bottom, we have upcoming enhancements. So each quarter, we will try to update this to reflect what new metrics may be coming in the future as far as updates are concerned. Currently, here we have living arrangement because we aspire to be able to put visuals to track the current living arrangements for individuals that are on the wait list. There is also a button for frequently asked questions. So if you click this, it will take you to our FAQ tab. Next, we have services, and this is a separate tab that we're adding this quarter. So for reporting period, if you wanted to filter, we only have this month, but we will continue to update this quarterly, so more dates will be added. You can do the same thing as the previous tab where you can filter by tailored plan as well. There are 5 visuals here that reflect services and us tracking services according to what's on the wait list. First, we have this pie chart indicating how many individuals are receiving services, and this is for this reporting period, so from January to March of 2025. Note that percentage differences may be shown compared to the published quarterly reports because this metric is inclusive of a wider list of services. So this is not IDD specific. The visuals below show average number of services received. For this quarter, it was 2 per person. And then to the right of that, we have percent of individuals that have Medicaid, which is at 82%. Here with this bar chart, we have IDD specific services and their categories that have been utilized within the quarter. We have broken them down into care management, home and community services, respite, and employment. And the cool part about hovering over each of these bars is that it will show a service category explanation, which will help better understand why we chose to categorize services the way we did. You can also click on this eye icon up at the top of the visual in order to view the service category disclaimers for more information. The last visual here is service types utilized. So here, these are not IDD specific. We do include IDD services, but we also include mental health / SUD, ancillary services, TBI, and crisis. We also have further information to get a better understanding of about whether or not a service is state funded or not state funded. Those that are state funded are indicated in a light blue, like you see here. We also have some disclaimers at the bottom of this tab where we break down where we have received the data, how we've used it to get certain calculations, who is included in some of these calculations, and then who may be receiving multiple services or no services at all. So these disclaimers give a better idea of how we've calculated some of this information. Next, we have our FAQ tab, where you are able to get more of a generalized answers to some of the questions that we get most often. So for one, where can I find more information about the innovations waiver? We provided a website here that gives you more information regarding that. What data sources does this dashboard use? When will this dashboard be updated? Who should I contact if I have any feedback or questions related to the dashboard? We provided an email below so you'd be able to share your comments or feedback. And then also, who should I contact if I have any questions about the data presented on this dashboard? Because most of this data comes from the LME MCOs in a quarterly report, some of the questions that you have, especially pertaining to certain counties, we may not have as far as the state. So you would need to reach out to the LME MCOs that serve that particular county, and we've provided their contact information here, as well as the counties that they serve. Finally, we have our disclaimers, and these again provide more in-depth understanding of why we have done a lot of the calculations that we done, as well as how we've grouped certain things. We have general disclaimers, for example, to protect an individual's privacy. Data for categories with less than 11 people would be displayed as less than 11. So you would not get a definitive number if an individual count is less than 11. We also have age disclaimers, diagnosis disclaimers, in particular for those who want to understand what is a qualifying IDD diagnosis. Those are there. We also have service categories here where we give disclaimers by giving examples of certain categories that we've used. So for instance, we have home and community here, and we provided examples of services like supported living, day supports, community living and supports, and personal care. And those were bucketed into that category. So it gives you a better understanding of what's included. That concludes our brief wrap up or walkthrough of what is on this dashboard and how to navigate it. If you have any questions, please reach out, but thank you all for your time.